The following segment is sponsored by Revere Health. It is so important to know your own risks, especially when it comes to bone health. Dr. Reed Parkinson is here to tell us what we need to watch out for. Dr. Reed, great to see you.
Thank you, Carrie. Good to be here.
Okay, so tell us, who's likely more to have a bone injury, men or women?
So by and large, women are more likely. About 50% of all women in their lifetime will have some type of fragility fracture. And men, it's about 25%.
Okay.
So about twice as likely as men.
Wow. Okay, and why is bone health so important?
So if you're older and you get a fracture, it can be just devastating. So if a person in their 80s gets a hip fracture, that can kill them. So it's a very dangerous type subject, and so you want to be really careful when you're talking about bone health and make sure people are healthy.
Sure. Okay, I don't know if I'm saying this right, but a fragility fracture, what is that?
So fragility fracture is where if you fell from ground height or from standing to falling or sitting to falling and you break a bone, that's not normal. So we actually call that a fragility fracture, meaning your bones are so fragile that just falling to the ground breaks them. So that shouldn't happen even if you're older. That's kind of an abnormal thing always.
Just to fall and break a bone. Okay, let's talk about bone density loss. What is this?
So we like to measure bones and we say they're dense, you know, the density, and something we can measure. And so we say as you get older, your bones may get less dense and less thick, and that makes them more brittle. So if you have thin bones, it's kind of like having a thin piece of wood or metal. It can just break. So thin bones is obviously dangerous.
Is there anything we can do about it or to prevent it?
Well, there's loads you can do. So one of the most important things is good calcium intake, vitamins, things like that. But the most important thing that I tell all of my patients is actually weightlifting.
Interesting.
So I tell every patient 2 to 5 pounds of slow density weightlifting can prevent or totally reverse bone loss.
And why is this?
It strengthens the bone, and a lot of old people stop exercising, and you get less active, and it can weaken the bone. So any type of bone strengthening exercise is good.
Okay, what's a Dexa scan?
So a Dexa scan is a low-density X-ray scan that you do. It takes about 10 or 15 minutes, and it checks your hips. Sometimes we do wrists, and we do your back. And this can actually tell us how dense are those bones.
Who should be getting these? Should we all be getting these scans?
So generally we say anybody over the age of 65, particularly females, should get it because you're postmenopausal. You've gone through menopause, and so your bones can be weaker. But also anybody that's had a fragility fracture at any age, and also, you know, other things like if you're on steroids long term or something like that. So there's a bunch of things, but generally women over 65 should always have one.
Sure. If we have any questions, we can also go to Revere Health for more information. Doctor, thank you for all this info, and it's so important, our bone health, to pay attention to that. Thanks for being here.
Thank you.